dermatology at Pediatric Specialists of Nashville. We're located on 25th in Charlotte, so not too far away. We accept all insurances, we do payment plans for self-pay girls, so if y'all have anybody that's needing those types of services, we would love to see them. So we're going to talk today about reproductive planning, becoming one of my favorite topics. So credentials, we have dermatology also there. We serve girls up to 21 years of age. So we've seen very young girls for like vaginal issues and things like that, but mostly starting when girls start their periods if they're really heavy or have a lot of cramping or they're irregular and want to get that addressed. Obviously, birth control, STD testing, treatment, and reproductive planning. So the planning part for my girls is kind of like a reproductive planning issue, and my practice is in the infantile state. It's kind of just starting, and I'm really excited about it. Like, you can really get to know a lot of these girls very intimately by learning about what their plan is and what they want to be, how they want to get there, their goals for their life. So hopefully y'all will enjoy it too. But a reproductive plan, not very difficult. It's a set of personal goals about having or not having children. So that's straight from the CDC. So it is recognized, it's an actual thing. The government promotes it. They recommend that everyone have one, male, female, young, old. They want you to have a plan. So what I like about the way they phrase this is that it's a personal plan. So it's not something that is passed down from healthcare providers, from teachers, from counselors, from parents. It's your personal plan. It reflects your own values, goals, resources. It's for you. So, our job would be to obviously educate them on the risk and the benefits and help them, kind of guide them through their decision-making process, but ultimately, these are their decisions. So I kind of like that about it, and it kind of takes the pressure off us. I mean, we don't have to make these decisions for these girls. I mean, they're making their own decisions. We just need to make sure they're making educated ones. So we get to print facts and leave our own values out of it, which hopefully might protect some of us when we're talking about the law and all that. So why make a plan? So when I was thinking about why in the world anybody would care to sit down and think about when they want to start having sex, or what that's going to look like, what they want to be. Statistically, from CDC, again, the median age for when females, and these are HIV negative females, start having sex is 15 and a half. So it's younger for HIV positive girls. So those would be obviously the girls that are more at risk, and statistically speaking, started at a younger age, had more sex partners, thus their risk was increased. So when you think about when you want to start, it would be very young. I mean, I'm thinking elementary school. I'm actually thinking, like, my mom, kept a book when I was little, when I was a toddler, and asked me, like, all the time, what do you want to be when you grow up? That went in the book. So that's part of a plan, right? I mean, that's a plan for your life. So it started as a toddler. So those kind of questions can be asked very early on. And then when you get into puberty and those kind of stages, obviously you have to bring in pregnancy prevention and sex into the mix. But so elementary school, absolutely middle school, no question, high school, and beyond. The primary predictor of an individual acquiring HIV or another STD is the number of lifetime sex partners. So our goal is to have them obviously start later. So we're wanting them to delay their sexual debut. Hopefully that will be something they're thinking about, and we can kind of give them, I'm going to give you ammunition today for helping them to make that decision to delay the onset. So the goal is to delay, to increase the number of partners, and that kind of goes with a delayed sexual debut. There's a 30-fold higher risk of acquiring an STD, specifically HIV, but all STDs, when you start sex early. And there's a 7.5-fold higher risk if you have more than 6 sex partners by the age of 20 for getting HIV and STDs. So this was for male and female. All right, so more reasons for making a plan. I'm sure that a lot of y'all know this. Half of our high school students, nearly half, are already sexually active. Over 1,000 teen girls.
Could you speak up just a little bit?
Yes. Do I need to use the microphone?
No, your voice trails off.
Oh, I know.
And it's hard to understand.
Will that help a little bit?
That's much better.
Okay, thank you. Thank you. So nearly half of all high school students have had sex, and there are 1,000 teen girls will give birth today, or over 1,000. Even more things that kind of talk about breaking the trend of teens having, or babies having babies and things like that, and trying to get these girls to delay onset of sexual activity. Is 33% more likely to become a teen parent if you were born to teen parents. So if we can get you out of your teens before you have your kids, maybe we're hoping to break the cycle. 50% of teen moms get their high school diploma by the age of 22, compared with 90% who are not yet moms. So we know that having kids obviously makes a lot of things more difficult, just as far as timing, energy to go to school and things like that. So this is also one of those things. I mean, if you're talking to a girl about what she wants to be when she grows up, and that is if that her plan includes a degree or finishing high school or going on to get her master's or a doctorate or whatever that is, it's going to require schooling, obviously, education. Statistically speaking, it's going to be harder for her to get through school if she has a baby. So let's talk about how we can prevent that. Unintended pregnancy, more reasons to make a plan. Unintended pregnancy rate in 2006, which is the most recent data that I could get a hold of, was 49%, which actually has gone up just 1% since 2001. But even with all of our, technology and different forms of birth control and all this education and stuff that we do, the incident is still going up. Luckily, in the 15 to 17-year-olds, it did go down a little bit, but in the 18 to 24-year-old, it actually increased. Lower income increased there, and cohabitating increased there as well, which makes sense. Unintended pregnancy can lead to a lot of problems. So the CDC is really focusing on making a plan to promote timely pregnancies, timely anticipated, healthy pregnancies. So when an unintended pregnancy occurs, there's usually could be a lack of prenatal care. I mean, if you aren't expecting to be pregnant, then, and let's say that you're used to having irregular periods or whatever it is, then you wouldn't necessarily think that you were pregnant based on missing a period or having one late or whatever the case may be. Some girls still have periods even while they're pregnant. So there could be a lack of prenatal care, so that can affect mother and baby for sure. Close pregnancy intervals, we'll talk about birth spacing just a little bit more later on, but close intervals have a lot of risk for mother and baby. So being able to space out a pregnancy because you thought about, when do I want to have a baby, and now when do I want to have my next baby. So spacing that out creates a healthy environment for the baby. Unexpected financial burden, obviously kids are very expensive, we all know that, but when you aren't expecting it and maybe you're still in high school, middle school, whatever it is, you don't have a job, then that stress, that added stress of an unexpected financial burden just adds to, to the whole issue with pregnancy. Vitamin deficiency, we'll talk more about that a little bit, but folic acid and iron especially are two big vitamins that, anemia is low iron. Folate deficiency, you wouldn't necessarily know that you had that, but it can cause birth defects for the baby. So they recommend now that prenatal vitamins be started 3 months in advance of conception. So it's good to, talk to any girl that has uterus and ovaries and is ever thinking about having sex to just go ahead and maybe get on a vitamin, shoot a couple Flintstone a day, something like that. And it has everything, it has things she needs in it as well, vitamin A, B, C, D, all those good ones. Exposure to alcohol and drugs. If you weren't, thinking a baby would be in your uterus, you may not be treating yourself as a vessel. So you could expose yourself to drugs and alcohol and not understand that that is affecting someone other than yourself. So trying to plan it would hopefully prevent that from happening as much. Chronic diseases that are uncontrolled, specifically off the top of my head, like blood pressure issues and diabetes. Those would be two big ones that are chronic diseases that greatly affect a pregnancy, can cause, you to have to be induced early, can cause obesity and diabetes in kids later, the baby that you want to have later, it affects them in their life as well. So planning pregnancy helps you to try and get some of those things for yourself under control to create a better environment and a healthier child even. Overweight and obesity, of course, epidemic now we know, and so that greatly affects pregnancy by itself, but then you also get to add in some of the diabetes issues, blood pressure issues on top of that. So I found this, when I was doing research on the CDC website, I found this study that was done in it terrified me, but kind of went along with what I see in my practice and I talked to my girls. So this was a study done with college males, and their conclusion was that the youth were extremely challenged by achieving perfect use of contraception because they chose intimacy over correct usage. And that's just with condoms. This isn't just, with birth control. So these males who were taught about condom use during college, 60% of them did not have a conversation with their partner before having sex. 43% put it on after starting. 42% wanted to use them but didn't have any available. Lack of planning there. Hopefully it was lack of planning. 40% did not leave space at the tip of the penis for the ejaculate. 32% lost direction associated with condom use, which I can only assume will lead to further non-condom use. 30% placed the condom on upside down, and 50% removed it before ending sex. So we can't assume anybody knows how to use a condom, even a boy. And then a girl can't assume that the boy knows how to use it. It goes into every sex talk I ever had, I'm sure with you guys too. You have to be in charge of that. That is your job. Yes, ma'am.
Put the condom on upside down?
Like, inside out.
Okay, that makes more sense.
They say upside down. You're right. And I just assumed inside out. But I could see that would be difficult. They would find a way. I bet. You're welcome. Okay. But I do see with my girls that a lot of them, I ask them if they use a condom, and surprisingly often I hear, I do not know. How do you not know that? So that terrifies
You
me.
said you asked them if they use condoms and they said they do not know.
If their male partner uses a condom, yes. And they do not know.
They're having sex?
Yes. They do not know. They do. That's their answer to me. So I try to hold back. We don't want to show them how crazy that is. But, so we just don't. Oh my goodness, thank you. Yes. But that is not what happens. So just keep this in mind. This was just shock factor. Open everybody's eyes to the fact that this stuff is real. Like, this was a real study put on by people who do studies. CDC put it on their website. This is for real. So birth spacing. So when you talk about reproductive planning, you got to talk about pregnancy and having babies. I like to start earlier than that. Obviously, we talked about starting even in the toddler year, middle school. But some teenagers already have kids, obviously. So we need to at least think about spacing them out. Once they've had a baby, they probably, I would assume, don't want to have another one immediately, most likely. So there are a lot of reasons to get them on very effective birth control very quickly if they choose to have sex again and want to be on birth control. So after live birth, recommended interval before attempting another pregnancy is 24 months. So that is to help decrease adverse events for the mother, the pregnancy, the baby. At least 2 years. So from you celebrate your baby's second birth date, and then you can start thinking about conceiving again, and that would be in the safe area. That does not mean you should. That's not when you should start having kids. You'll see Nina handed out some handouts from the CDC about helping these girls make their plans and the questions to ask when you're advising these girls on their plans. So it even says on there going over 60 months, like 5 years can be risky as well. But I would just keep in mind, they're teenage girls. They're otherwise healthy is probably absolutely fine to space out as long as they would like. It is their choice. And a lot of pregnancies, even when they're spaced close together, normally be fine, but there is increased risk. So they should know that there are a lot of reasons to get on very effective birth control pretty much immediately after having a baby. So that's from World Health Organization.
I do have a quick question
Yes,
while you
ma'am.
were talking about birth control.
Yes, ma'am.
How do you handle when a teen does come in or a young lady does come in and she's had a baby and then you suggest birth control and they state that they don't want to use birth control for the various side effects or anything like that? How do you work through that conversation?
For myself, I start with things like this, data like this that says, if you get pregnant early, this second baby's going to have a lot of problems just coming out, just starting. I would go into, I would talk about their financial aspects. I'd probably start with what are you going to be when you grow up. That's kind of my go-to, like what do you want to do? I'll ask 24-year-olds, what do you want to be when you grow up, And is that going to involve, going to some sort of school? Is that going to, do you want to be a stay-at-home mom and have 20 babies? Okay, let's talk about that. Let's talk about the birth spacing, staying on your vitamins. Again, it is their decision. So I do a lot of counseling. I'll spend a lot of time with them, giving them all these reasons to wait, and ways to wait. We talk about the good birth control and the benefits that you'll get from birth control. I'll scrape the bottom. I'll do whatever I can to convince them. But in the end, again,
Do you address the risk factors with the birth control as well?
risk factors, birth control, yes, absolutely. And I always kind of conclude that with, but the other risk is pregnancy. And pregnancy is one of the most dangerous things an American woman will ever do in her lifetime. So I always will put that in there, like we'll go over birth control a little bit, but some of them have very high doses of hormones. They can cause clots, like a heart attack, stroke. It is still safer than being pregnant. So even if that's a risk to you, if that's the only thing I can get you on, well, let's talk about that. So, thank you. All right, so less than 6 months. So if we're really going to get somebody, they don't want to wait 2 years, they want to wait less than a year, let's get them to try and wait longer than 6 months. This greatly increases their risk for mortality for the mother and the baby. Low birth weight babies, small gestational age babies. So these are just issues where the baby's in the NICU usually for a little while. This causes some problems with their development. They always worry about weight gain with babies and things like that. If they're born too early, they can have issues with cerebral palsy and some mental retardation, different things with disabilities just from early pregnancy and delivery. Preeclampsia, high blood pressure. With your very young girls, and especially with their first pregnancy, that risk is even higher. So this is something that can absolutely make you deliver your baby early before you go into having seizures and death yourself. So a lot of them don't realize that this preeclampsia thing, toxemia, if you've heard of that, is very serious. And if you can wait longer, that it decreases your risk for that happening. Maternal depletion syndrome I thought was really interesting, so I wanted to bring that up. Talking about the vitamins and prenatal vitamins and all that good stuff. When you have a baby and or nurse, you lose a lot of vitamins. I mean, the baby's going to get what it needs, and then you're going to be left with whatever is left over. So I thought it was interesting when I was doing rotations through school, a lot of the psychiatrists were starting to write vitamins, like especially folic acid, some vitamin D, to their patients for depression, schizophrenia, different psychiatric disorders. They had thoughts and some evidence to prove that those vitamin deficiencies might be worsening their illness. So now they'll add that to their medication list. But what I found through CDC is that this maternal depletion syndrome, so if you don't have enough iron and folate in your system at the time that you get pregnant and throughout your pregnancy, can increase your baby's risk for autism and schizophrenia. It's actually a threefold risk if you get pregnant within a year for your next baby to have autism. So, if I knew that I could do something to help prevent mental illness in my child, especially if that runs through my family, that might be a very good point to bring up to that person about why you should wait longer. So that was really cool. So there are a lot of benefits to planning, and most of them are just the opposite of the risks that we just talked about. So a decreased number of lifetime sex partners. If you plan to wait longer because you'll meet some of your personal goals, that will decrease your exposure to STDs and your incidence of getting an STD. You have an increased ability to get your diploma, and obviously to hopefully have that lead you to an increased income so that you can better support yourself and your future children. Increased likelihood of a timely and highly anticipated pregnancy instead of being something that you were surprised by and are halfway dreading. This is something you very much wanted. Able to attain and replenish your nutrient stores to prevent maternal depletion syndrome. You're able to prepare and recover from the physical demands of pregnancy. And able to set goals for yourself, your family, the kids you have now, or your future children. You're able to create the best possible environment for that pregnancy and allow the uterus to become more taut. So another issue with having babies very close together is that the uterus doesn't have time to fully contract. So you have issues with bleeding. One of the reasons you want the uterus to draw up very tightly, very close to having had baby, is that it stops your bleeding. So if the uterus isn't contracting, if that muscle isn't working, you get issues with bleeding, and people can bleed to death. So it kind of gives your body time, your uterus time to forget what it did, get really strong again before you put another baby in So let's talk about starting our plan. So we talked about when to start. This kind of gets into the details of what kind of things you might want to include, and a lot of that is in the handout that you've been given. So what do you want to be when you grow up? I like that question first because it really, before you get into sex and pregnancy and all that stuff, STDs, you get to talk about, what is your goal? What do you want to be? And people decide that usually very early in life. And of course it changes all the time for some people, but sometimes it doesn't. And so that can lead you into a lot of these different branches of routes to go for your planning and for your questioning when you're advising these girls or boys. So my follow-up question, if somebody has told me that they are not currently or have not ever been sexually active, my follow-up question is, when do you think you would be comfortable having sex for the first time? So that's a very open-ended question, right? I didn't ask them, how old do you think you need to be when you start having sex? Or where do you want to be in your life before you start having sex? I just asked, when do you think you'll be comfortable? So that could mean a lot of things to them, but if they have trouble figuring out an answer for you, they could state an age. I mean, some people say, I need to be 18, because that's an adult, or need to be 21, or whatever it is, or my mom was 17, or whatever their case may be. Age or quantity of commitment I put is, maybe if you don't have a certain age, and you're kind of floating around that idea, maybe it needs to be with somebody, the same person, consistently for 6 months, a year. I like to start with a year, but for a while, and give them kind of a time frame just to get them kind of thinking. But maybe they haven't thought about that. Maybe they haven't thought, well, maybe I should be with somebody for a while. So try to get them away from the one night stands more into the planning mode. Marriage, do you want to be married first? Some people will say that. Graduate from high school, do you want to have your college degree? Do you want to have your master's? Do you need to be done with all of your school so that you can focus really on a relationship and a possible baby, because that's always a possible consequence, right? Do you plan to use condoms? Very good follow-up question, since we know now that they're not being used really correctly. Do you plan to use them? And a lot of them are, of course, going to say yes. Okay, well, what if do you have a latex allergy? I mean, I know that sounds like a silly question, but a lot of them don't know that they're alternatives to latex condoms. The preference is male latex condom. That is proven to be the safest, most effective condom. However, there are polyurethane, there's the lambskin, there's different ones. You can get around. A latex allergy is not an excuse to not be protected. His latex allergy, does your partner? What if your partner had latex allergy? Would you let him just go without? No. You have options, and you are very much in control of that, and that is your decision, no one else's. And I tell them that I preach that a lot, because I see that they let other people make that decision sometimes. And I try to give them a way to think about it. It's not a decision that you make in the moment. This is not something that you decide based on how nice this person is, or that you met them in church, or whatever it is. This is a decision you have for yourself, because that's the kind of person you are. You protect yourself, you respect yourself, and everybody who has sex with you will use a condom every single time. That's a rule you tell them up front, so there's no questions about that. And that tends to hopefully avoid some of that awkward conversation. Do you plan to use birth control? So that can lead you into the birth control discussion, and maybe you can give them their options, or you can refer them to me, and a gynecologist, obstetrician, somebody you can get them on something highly effective. Do you plan to get tested before you have sex with each partner, or do you plan to have your partner be tested each time? So, and that's not an exhaustive list. I mean, it leads you into lots of different things based on what their response is, but just don't be afraid to ask these questions. I mean, these are things they need to be thinking about. We all should have a plan for that kind of activity, and it's not wrong to think about it in advance. It's the best idea. So I encourage them to think about it. I tell them I don't want to become obsessed about sex, but I want you to please think about it. Feel free to write it down, keep it in a journal. It may change over time. That's totally fine, but have a plan for what you want to do. This is your life. More things to include. Do you want to have kids? How old do you want to be before you get pregnant? Or where do you want to be in your life? Not even how old. You can ask them about when they would be comfortable having a kid. And if not, how will you prevent them? We're going to do abstinence, which of course is very safe to promote. So you can talk about birth control. What would you do if you did become pregnant? You know all of your options. That is something that the gynecologist by law has to talk about. So if y'all are not comfortable with all of that, please send them on. What medical conditions, mental health conditions, medications are you on? Are you a smoker? Do you binge drink? Do you have eating disorder? What kind of things are going on for you that you might need to get addressed before you decide to become a mom? So, that would be something that I talk about a lot, since they hopefully are telling me a lot of these things are going on with them. And y'all would know a lot too, just from getting to know them. So when to start, I recommend as a very young child, start talking about their goals, their dreams, what they want to do. In middle school, we can start asking about sex. I think that is completely reasonable based on the age that, statistically speaking, that they're going to start. High school, we need to be asking about kids, and hopefully a lot of them are going to be deferring that until later on. Well, then we need to make sure that they know how to prevent that and do it well. The goal per the CDC and the government, we've heard of Healthy People 2010, now they have 2020. The goal is to improve pregnancy planning, so that's why they love their reproductive plans, spacing, preventing unintended pregnancy. They would like to get the rate of the intended pregnancy rate up to 56, so right now we're boarding on 51. Increase access to contraception, especially the long-acting reversible forms. So that brings me to the contraception, because I know that when y'all get to know these girls and they start trusting you, they come to you with lots of different questions. A new study came out, these long-acting reversible forms, like the Depo-Provera injection, the implant-on implant that goes in the arm, or the IUD, are 20 times more effective than pills, patches, or rings. So 20 times, that's a very large number, and I use that when I'm discussing contraception with these girls. I want them to understand, and I've seen it in my practice for sure. Pills are not the way to go for an adolescent most of the time. There are a lot of pregnancies that happen on pills. It's difficult to do. It's a daily thing, same time, every single day. Medications can interfere. You gotta get to the pharmacy every month to pick them up. You gotta make sure they're with you every time you want to take them. It's work. It's a lot of work. And yes, they should be able to do that work if they're having sex. You can go into a big argument with that, but it's even if you work your butt off and you're taking it perfectly at the same time every single day, it's still not as effective as getting a shot 4 times a year or putting this implant in your arm. So these longer acting reversible forms are now the recommended forms for adolescents. So just more about those. The shot, the implant, and the IUD are those ones that are considered long-acting and reversible. They are dosed every 3 months to 3 years. IUDs can be up to 10 years. So if you're not planning on a baby soon, then a long-acting form is going to be a good option for you, most likely. They're very easy to use correctly. They're actually very difficult to mess up. They have a side effect and a benefit of a decreased amount of bleeding, and that subsequently helps with cramping most of the time. Yes, ma'am.
Are there age, because I've heard that, are there age requirements when it comes to the implant and IUDs?
For the implant, there is not an age requirement for the implant. I've had some obstetricians say that they will not put them in if that person does not admit to being sexually active. So if they ask them a question, are you sexually active? Are you using this for birth control? And they say no, they won't give it to them. So I've had that issue come up some, but for the implant, no. For the IUD, it is recommended, it's still recommended that you have had a baby first.
Before you get
Yes,
baby?
yes.
Okay.
But as far as
Why
age,
is that?
there are a couple of reasons. One is that they feel like the uterus needs to be big enough to hold this T-shaped IUD. That's intrauterine device. And then the other one that the obstetricians I worked for always told me was, there, and it's falling out of favor, but there was a risk for PID, so pelvic inflammatory disease. You have those strings that hang outside of the cervix into the vagina, which kind of gives chlamydia, gonorrhea, whatever it is, an easier way to travel into the uterus, into your tubes. PID can lead to infertility. So if you have a baby already, if something happened and now you cannot have more babies unless you have a baby, it's kind of one of those things that I think it's a lawsuit protection kind of thing
And
as
so with
well.
the IUDs too, they do recommend that you are at least in a monogamous relationship, right?
Right.
Okay.
Yes. And I do know that there are some obstetricians who they're not following that rule. I think you could find somebody who's going to say, you're a teen, that's an awesome birth control because you're,
Right.
And your risk for PID, now that they're doing more studies, probably isn't as high as we thought it was. So you can find somebody to do that, but it is a procedure. I've known, we've heard cases, everybody's heard weird things,
Yeah.
but had a girl that had to have a hysterectomy after having hers put in. So it's just, there are a lot of reasons to make sure you have had a baby and that you are monogamous. So,
And
but yes,
then
thank
with
you.
your birth plans, when you go through, Are the parents there, or is this something you do one-on-one with the teen?
I do this alone, yes,
Okay.
I do. I have, we do private girl chat at every visit, and so
Okay.
parents leave the room. I like to do it alone. It's fine to do it, I think, in front of them as
I
well.
wasn't sure how that
Yeah.
works.
And that's mostly because I don't want, it is their personal plan. And a lot of moms will want to have input, which is absolutely their call. But, I want to hear from them what their plan
So
is.
you do ask the parents to excuse me?
Yes, every visit, every time, yes. And it's policy, so.
Oh,
It was weird at first, I'm used to it now. I
right.
get that look, but it's okay. It's worth it. It's worth it. The girls are good. So the cons from these methods, if they want to know what the risks are, I mean, there's a few more, but the big one is the irregular bleeding. So with like a pill and a shot, or a pill and a patch and a ring, you should have regular periods, hopefully, if you're using them correctly. And they're working for you. So irregular bleeding at first to the point where it's so light that it finally stops. So that kind of gets on their nerves at first, but I tell them that it's worth it. It may require a small procedure to have it inserted. The rod's going to require a numbing shot and then a bigger needle going in to put the rod in. You got to get in Pap-smear position for an IUD to be placed. And that's kind of uncomfortable for some people, the actual insertion. So pills, rings, and patches. I almost put like the devil, just put the devil right there, for adolescent girls. They make me very nervous. I hand them out with a disclaimer that this is not the most effective option for you. Please be very careful. But they do provide cycle control. So if you really need help with just controlling the periods and you want predictability, and you still need to see blood every month, then the pill or the patch or the ring might be a good option. They help treat acne, most hormonal acne. And then the cons are though the dosing, so daily to monthly dosing, which is a huge con. Increased risk for the heart attack, stroke, blood clot. The estrogen in it can thicken the blood and cause clotting. So I don't get that so much with the other methods. The patch has 60% more estrogen, so that's why I put especially with the patch. So still safer than pregnancy, may not be safer than some of these other methods. Emergency contraceptive, I just want everybody to know about it, to hear about it, in case you get a girl who's in crisis. Definitely refer her if you're not comfortable, for sure. But these pills, it's a pill you get over the counter at the pharmacy called Plan B. You need to take it within 3 days and as close to the incident as you can to be more effective. But if you are 17 or older, you can go get it by yourself at the pharmacy. Just ask the pharmacist for it. If you're younger than 17, you'll need a prescription. And in August of 2010, another one came out called Ella that actually is effective for up to 5 days. So it was approved for 5 days, which gives us a couple more days to. But they're not great. They're absolutely no replacement for birth control. Birth control is by far much better. So the shot, the implant, they are 99.9% effective at preventing pregnancy. The pill, up to 99% effective. This is up to 90% effective. So really, it's only in emergencies. Condom breaks, for some reason, you didn't have one available, you decide not to use one, whatever the case may be, better than nothing, for sure. So they just at least need to know that is available to them. So our message to teens, according to the CDC, should be more risk with more sex partners, less risk with fewer sex partners, put that a lot of different ways. Virtually no risk with one lifetime uninfected partner. So delaying onset, promoting abstinence, very much goes along with what the CDC is recommending as well. One lifetime partner should be a universal goal, mentioned often in STD prevention messages. We should place a lot of emphasis on limiting the number of sex partners. I don't know that everybody would think about that, that we need to keep that number low. In order to do that, you need to start later. So that's a good lesson for them. And then all you should be encouraged to delay onset for all the reasons that we talked about. And then our message to us is that we need to talk to our teens. So it says parents, that could be anybody, guardians, counselors, wellness instructors, whoever it is, about sex, about their plan, about birth control. This has been proven to, if these teens are talking to us, that they start having sex at a later age, that they use condoms and birth control more often when they do have sex, that they have better communication with their romantic partner, which can lead to a lot of good things, and that they have sex less often. So that's actually been proven. So I thought that was a good message to us that, yes, this takes time, and yes, it can be tedious and uncomfortable at points, but it pays off, and we owe it to them. So talking to teens, it sounds easy, but is sometimes not very easy. And I recommend to some of my girls too, because I read a study also on the website that if you eat dinner with your parents, your guardian, whoever it is that you live with, 5 times a week, that greatly reduces your risk of STDs, early pregnancy, etc. So we cannot, belittle this idea that family is important, time with family is important. So I tell them to do game out, and I know they look at me like I'm crazy, like get a board game out, or do the Wii. I sound cooler when I say the Wii. But some sort of game. I know that's dorky, but it's proven to help. And a lot of them, they need that time with their parents. I mean, everybody is so busy. It is very good to take time. So if all you have time to say to this girl or this boy who's asking you for help is to say, go eat dinner with your family tonight, or something like that, start a game night, you be in charge of that, it doesn't have to trickle down from your parents, you start it, Mom, I want to play a game with you, that if that's all that you have time to say, that is proven to be helpful if they listen to you, so just say that. Allow them privacy, so even though it is uncomfortable to ask a parent to leave sometimes, it is something that I'm obligated and want to do, because I realize that a lot does not come out in front of Mom and Dad that should be told. So allowing them privacy, either that, maybe that's with you guys, can I call you later, whatever that is that y'all can do for them to talk privately. We'll find out a lot more about them. Try not to be judgmental when talking to them. A lot of times we want to, use our finger and point at them and all that stuff, but going back to this is their plan, these are ultimately their decisions, ultimately their consequences. We need to educate, but paternalizing and telling them what they can and cannot do, and can be more detrimental than helpful. So just keep that in mind as well. Be their advocate. Let them know that you're on their side. So even though you're telling them all these risky things, all these bad things that can happen to them, if they make these what we would consider poor decisions, we still want them to know that we are on their side. We're their advocate. We're not against them. We are for them. That's why we are telling them these things. I think it's good for them to know that they have an ally instead of someone who's, again, just telling them all the negatives that they shouldn't and can't be doing. Healthy choices, trying to make them appealing. I still struggle with this when I do healthy eating and exercise and all this stuff. So I just wanted y'all's help with that too. Try to make what should be done, what you think is the healthy option, give them all the benefits of that, which hopefully we've loaded up with a few of those. But even personal experience can be really helpful when you're trying to appeal to the pros of making healthy decisions instead of you cannot have fun by having sex, the good things about waiting and things like that. Okay, I think that's all I had, you guys. I don't know what our time looks like, but I'll take any questions. I want to say thank you to everybody who helped me with the presentation. Y'all have any questions? I'll talk fast. Y'all may have a long break, I'm sorry. Thank you guys. Thank you for everything that y'all do. Really.